Hello, and thanks for taking the time out of your very busy schedule to click on this video. Over the course of the next couple of minutes, I'm going to tell you about an exciting new program that Leica is very happy, pleased to make available to all of its member organizations that has the ability to save you significant costs on what's probably the second or third largest item on your P&L statement. Yes, we're talking about health benefits. Providing health benefits to employees has become very, very expensive in the post-Affordable Care Act era. And year over year, the renewals in the small and mid-market are very unpredictable and make it difficult for you to budget for your costs going forward. Working with Jerry and his team, we have developed a program that brings large company-style benefits to the small and mid-sized Leica organizations at a significantly reduced cost. My name is Terry Gorman, and I work for World Insurance. We're the company that has put this program together on your behalf and will be managing it going forward. We're excited to be giving you the opportunity to save a lot of money on providing health benefits to your employees. And how do we save you those dollars? Well, we do it in two ways. First, we're able, through our platform and our partner firm's platform, we're able to aggregate all the lives of the Leica member organizations so you're being looked at as part of one large group rather than a standalone group of 5 or 7 or 10 employees, whatever it may be. Secondly, because of the structure of our program, we actually underwrite the risk. So we know what your group looks like from a health standpoint going forward. So not only are you going to realize savings, but we're going to get you in the proper rate tier so that your renewals will be far more predictable year over year. We recognize that it is not a one-size-fits-all world. As a result, the program that we're making available to all member organizations of Leica will be effective on October 1st of 2022. Has many different options that you can choose from so that you can determine what is the best type of program plan or plans to make available to your employees within your organization. So with this program, we have two different umbrellas. We have a PPO option utilizing Cigna's national network, which will provide benefits that you're probably very familiar with, where you go to a doctor and you have a copay, you go to the hospital, et cetera. In addition, we also have a reference-based pricing option. Again, routine going to the doctor, and you can visit any hospital that you want to in the entire country. Within each of these umbrellas, the PPO and the reference-based pricing, there are 7 or 8 different plan design options, from very, very low deductible plans with very low copays, all the way up to those HSA eligible programs with a big deductible of $5,000 or $7,300 before insurance kicks in and picks up all the costs. Obviously, the more out-of-pocket costs a member is going to realize while using the benefit, the lower the monthly premium is going to be. The richer plans are going to cost more. But with our program, we have a rate for employee only, employee and spouse, employee, child and children, and employee and full family. In addition, we have a lot of other services that we provide that go along with this program. A medical advocacy service is there to work with any member within the program who's gotten a complicated diagnosis and doesn't know where to turn, doesn't know what type of treatment to seek, doesn't know what type of doctor or facility to go see. What is the best provider in their area to treat their particular condition? Well, working with the medical advocacy service, that member will learn of the survival rates, the morbidity rates, the complication rates of the various providers and services within their geographic area. And finally, the advocacy service can help set them up with all their appointments and manage the process as they deal with a very complicated and difficult treatment process. In addition, the advocacy service will also recruit new doctors into the network. So for a member that joins the program and finds that the particular cardiologist that they've been seeing for the last 15 years is not a member of the reference-based pricing network, PHCS, or the Cigna network, that medical advocacy service will reach out and try to recruit that physician into the network. And if they're unable to recruit them into the network, the next step would be to try to set up a single case agreement. So they'll be treated as if they're in a network, and it'll be treated for you, the member, as if they're in network from a copay standpoint, et cetera. And that doctor will receive reimbursement at the highest level they're used to getting. In 98% of the cases, when we come across a physician that is not in one of our networks and a member asks us to reach out and try to pull them in, we're able to accomplish one of those two outcomes where they either become a network member or they set up a special arrangement for that particular employee. It's excellent program that is available to every single member that joins the program. Now, this plan is not going to work for every organization within the LICA Association. It's going to be a better fit for some than others, but it's quite simple to find out whether or not it's a good fit for you. Steps are pretty simple. First and foremost, there is a census that needs to be provided along with a copy of current plan designs and the most recent invoice. Secondly, there's a HIPAA certified, secure link personalized to LICA that every employee within your organization needs to sign into and complete a personal health questionnaire for themselves and any family members they may wish to include in this program. If they know for certain that they're covered elsewhere and they're not interested in participating, quite simply, all they need to do is check a box saying they plan to waive, and they don't have to answer any more questions. But for members who do participate or will participate in your health benefits program, they need to take the 5 or 10 minutes to answer a few questions for themselves and any family members they wish to cover. Once all your benefit eligible employees have either completed the PHQ or indicated they plan to waive, it takes us about 2 to 3 days to determine what rate tier your organization would fit into under the LICA program. Vince, Rachel, or I will reach out to you with that rate tier and walk you through all the different options so you can determine whether there is enough of a savings here to make it worthwhile to move from what you're doing today and join the LICA program. Very simple process. If indeed the savings make sense and you want to join the program, Rachel, Vince, or I will work with you very quickly and easily to enroll your entire population into the program. Well, the program initially becomes effective on October 1st of 2022. Member organizations can join on the 1st of any month. The program will renew every year going forward on October 1st, but you can come into the program at any time on the 1st of the month. We're very, very excited to have this program available to you, and we think you'll be excited too. Vince and I will be traveling out to each of the various locations, the different state chapters, to meet with you guys one-on-one. But Vince, Rachel, and I are also always available by phone or email to answer any questions you may have about the program. World has set up this website for you that we'll walk you through right now, that has the links so that you can do searches for physicians, so that the link to the personal health questionnaire, frequently asked questions link. There's a lot of information that's available to you. And again, you have our email addresses and our phone numbers if you have any questions and you're not finding the answers to your questions on this website. We're very excited about this program, and I know Jerry and LICA is very excited about this program. You members have been looking for ways to save costs on this benefit that you need to provide in order to attract the employees that you want to attract. And we think that we have exactly the solution that the vast majority of you were looking forward to, that the vast majority of you were looking for, and we look forward to working with you. Thanks very much. and I look forward to talking with you soon.